Absolutely. OMRON Healthcare, you mentioned it. We're a leader in, especially in blood pressure monitoring and hypertension management, with expansion into the whole cardiovascular field via EKG and some other technologies.
Welcome back to another Tech Times exclusive interview. Today we're talking to Mr. Ranndy Kellogg. He's the president and CEO of OMRON Healthcare Inc. OMRON is the global leader in remote blood pressure monitoring and personal health technology. It's something that is extremely important prior to our current situation and especially now moving forward. So Randy, thank you very much for joining us today.
Thanks for having me, Chris. Great to be here.
Absolutely, it is a pleasure. First, congratulations on your, you took home a couple of Best of awards from a recent consumer electronics show, the CES. So congratulations. I know that must be very exciting.
Thank you. It's always exciting when we get recognized by people outside of our own company and even outside of our market, because it's tech interviewers, tech reporters who are saying, hey, this really looks good, let's dig in more, and then awarding us some nice things.
Right, yeah, recognition is always appreciated. And so let's jump straight in. Could you maybe give us a brief, what does OMRON do? Absolutely.
OMRON Healthcare, you mentioned it, we're a leader in, especially in blood pressure monitoring and hypertension management, with expansion into the whole cardiovascular field via EKG and some other technologies. But our core for 40 years has been helping people take care of their hearts. It's been our mission. If anybody watches our PR, even when I speak, we talk about our mission of going for zero. Going for zero is the elimination of heart attack and stroke. And we truly believe that blood pressure monitoring, hypertension management is the key to doing that, because it's the first thing that happens to you when your heart starts to go bad is your blood pressure goes bad. It's been called the silent killer. All the different charities like the American Heart Association, American Medical Association, international recognition of that has led to many people monitoring their blood pressure better, and we really try to do that. So that's our goal, that's our mission, that's what we've been trying to do for 40 years and really trying to do for the last 10 years.
Okay, well, fantastic. So I understand you have specialized products for a couple different regions. If it's all right with you, I would like to discuss each one, in depth or not. If you give us a brief or, however you want to do it. So first we have, for the US region, you have Vitalsight. So could you maybe enlighten us a little bit on what Vitalsight provides to consumers as well as patients?
Absolutely. So Vitalsight is our remote patient monitoring platform, our remote patient monitoring solution for the US. It's designed specifically for the US because of the way healthcare is delivered here. It's delivered differently than you'll see when we talk about HeartVoice or Hypertension Plus and other markets. And what we do with Vitalsight is we provide, through the patient's physician, a kit. The kit comes to the patient ready to go with a blood pressure monitor, a cellular hub, and if the doctor wants it, a scale. The reason we use a cellular hub is that in the US, not everybody has Wi-Fi in their home. Not everybody knows how to hook up Bluetooth very well. So we do all that for them. When they get the package, they open it up. All they have to do is plug in the hub, everything works. So they start taking their blood pressure. The kit or the device is already synced to the doctor's electronic health record. So in the US, if you visit a doctor, they spend more time looking at the computer and the electronic health record than they spend looking at you, which we need to change over time, but that's what it is today. And we now deliver their blood pressure information, their weight, directly into that. So when the physician is looking at the chart. They see all that. On top of that, the system also uses the parameters that the doctor enters to alert them. So if you're a patient and you're not hypertensive right now, you're doing well in your medication, you're never going to pop up in the doctor's alerts. If suddenly something happens, your blood pressure goes up dramatically, or even goes down dramatically, you will now pop up in the alert. The doctor or his or her nurse practitioner or physician assistant will see that, and they can give you a call and say, hey, what's going on? It can be little things like someone ran out of medication. Happens all the time. They stop taking the medication a few days. Wow, their blood pressure shoots back up. But now we've caught it early. It could be pressure. It could be stress. It could be their condition worsening. But this all pops up with the doctor in their EHR. So our system is designed to work specifically for them in their EHR system and alert them the same way they would get alerted for a lab test or some other documentation that will pop up in their system so that they can take action. We're really trying to connect the doctor and the patient closer. In the past, I would go see my doctor. He would say to me, I want to monitor your blood pressure, but that's the last time he'd see my blood pressure for 3 months until I showed up the next time. Now we're providing that data consistently through the timeline and even beyond it. So if I'm still under control, but I go out of control later, it still shows up. So it's a really great system. The key thing to it is that cellular hub, because in the US, as I mentioned, not everybody has Wi-Fi in their home. And especially as we're trying to integrate into areas where there may not be the correct equity in healthcare. There may be fewer doctors, they may be way out in the country. Using a cellular product works very well for that population. It also works very well for the inner city population who may or may not have the connection that they need. So you don't have to have a connection, you just have to have the kit and use it.
Okay, so let's talk a little more about the usage of the kit. Now, is this a wearable, or do you need to maybe test yourself, twice a day, so that there's there is data to be received?
So we use our standard blood pressure technology. So our upper arm blood pressure monitor comes right with it. So you take your blood pressure just like you would have if you bought your own kit or own blood pressure monitor at the drugstore, or if you had one already and were using it. So we don't change the way they do it. They don't have to be fit for a wearable or anything. And the doctor and the healthcare institutions in the US really prefer upper arm readings to wrist readings or other readings at this time. We're going to try to change that over time, but we don't want to buck the trend. We know they'll look at these readings and read them. So we use the standard technology. So the patient would have to take their blood pressure usually in the morning, maybe at lunchtime, and definitely when they go to bed. We always recommend 2 readings, morning, evening, but the doctor may say, I want you to do 3. I want you to do 4. I want you to do it every other day. So the doctor can tell the patient what they want them to do. The data will just flow. And if they don't take their blood pressure reading over a certain number of days, it'll alert the doctor to that too. So someone can call up and say, hey, what's going on? Even to the point we can see in the system if a patient is using the product, and if they suddenly stop using it, our customer service can call them and ask them, is there a problem? Did the batteries run out? Did you lose it? Because those little things can be a big difference. And if there's a problem, we can walk them through technically, great. If not, then the physician or the physician's team can get on the phone and help them with that. So we tried to match the way people have been taking their blood pressure. Over time, we could move into wearables, we could move into wrist units. Any type of blood pressure reading could go into the system. The key for us is making sure that data gets to the doctor and gets to the doctor in the way she or he is normally looking for it.
Okay, well, I'm sure that's extremely helpful. Like you said, it's a silent killer. So you know, and for people to have to travel, or, you know, like if you were to get tested, you know, your blood pressure tested every day, that's prior to Vitalsight, that is an insane concept, right? To go every day. But now,
Right.
you know, and, you know, maybe some people, that's what, you know, really in the past, that's what they needed. Like it needs to be tested like every day at least, or, you know, like I said, every other day or once a week even would be a hassle prior to Vitalsight, I would believe.
Yes, and it creates a good habit,
Mhm.
because once you start doing it, like, you know, I'm not a great example because I work for the company, but every morning, the first thing I do when I come downstairs, after I turn on the coffee, is I sit down in my chair, I rest for 5 minutes, I put on my blood pressure monitor, and I take my blood pressure. I do the same thing before I go to bed, but it's a habit now. It's like brushing your teeth. We all, I should say not all of us, but most of us, before we go to bed, we brush our teeth. We can also create the scale in the same way. You can stand on the scale, and as soon as you're done with the scale, you can sit down and take your blood pressure. So it is a great habit to develop, and you don't have to go anywhere. It's in your home. You just do it right there. If you travel, the box is not very big. You could take the whole box with you and plug in a hotel or at your son-in-law's or your son's or your daughter's house, wherever you go to, you could do it there too. And it doesn't matter where you are, it still sends the signal, it still gets to your doctor, and it shows up in their electronic health record.
Well, that's fantastic. You know, and this is obviously a tool for, you know, prevention of, you know, serious problems. But I think, I'm not going to say more important or less, I would say on a parallel of importance, the reassurance that these people experience, knowing, you know, okay, I took my blood pressure this morning. You know, nobody's called me, you know, that type thing would be very reassuring. You could actually probably enjoy yourself much more rather than, you know, thinking like, you know, I don't know if I feel like my blood pressure's up. Well, you can check it and the doctor receives it, and then you know.
Yes. Yes, and that's what's great about it, is that if there's something wrong, you're going to get a call. You don't have to call your doctor, make an appointment, drive there. You're going to get a call from their process, whatever it is in their particular practice or in that particular healthcare system. It could be the doctor, it could be the pharmacist, it could be a nurse practitioner or a physician assistant, but you're going to get a call that says, hey, we saw your blood pressure's been up for 2 days, 3 days in a row, whatever the protocol is. What's going on? Tell us about what's happening. And you have that short conversation, and 9 times out of 10, they can solve it right there. You know, whether it's I need a refill of my prescription, whether it's I've been under a lot of pressure, or if there's some other physical thing going on, they'll tell them, they'll say, hey, you need to come in and see us. We can make an appointment right now. So it makes it more proactive than reactive.
Yeah, that's fantastic. Proactivity is absolutely the key, and I think it also would maybe stipend or I'm sorry, not stipend, but I've lost it now. But, you know, it would lessen the amount of times, you know, that people maybe overreact and you know, they want to call and make an appointment because they don't know. It's like, what if?
Yes.
It's kind of, I would almost say this almost eliminates the what if factor when it comes to these conditions.
Absolutely. And the physician can tell the patient they're on this program now, and if there's an issue, they're going to get a call. And they can also explain to them, if you get one blood pressure reading that's out of whack, I'm not going to call you, because one reading doesn't mean anything. Right. It's when you have several days in a row of bad readings or inappropriate readings that you're going to hear from me. So don't worry about it. If you get up one morning, I mean, I had one the other day, I got up, I took my blood pressure, and wow, it was way high. And, you know, I thought this isn't right. But then I thought about it. I had been exercising that morning before I took my blood pressure. And one thing exercise does is raise your blood pressure temporarily. Right. And I just took it at the wrong time. But most people don't know that. Most people don't understand that. Or they drink their coffee before they take their blood pressure. A bad thing to do. Or they don't sit down and rest for the 5 minutes required before they take their blood pressure. So it helps create, as I said, good habits, and it also lets the physician interact with you around how you should take your blood pressure, when you should take it, and it's almost a compact between the physician and the patient that if you do what we talk about here, here's what I'm going to do for you, and it makes it much easier for them.
Right. Well, that's incredible, especially for, like I said, those people that are struggling with these conditions. So let's move across the pond to the UK and Hypertension Plus. Now, I realize that, like we spoke about prior, these aren't, it's not the same product rebranded for different areas and, focus groups on what name is more appealing, because that does happen a lot. So these products are actually different.
Yes.
Okay,
yes.
So
the blood pressure monitor itself is the same. It's the same one you can buy in a store, but the product, the implementation of it in that market is different. So for Hypertension Plus, remember with Vitalsight, I talked about a cellular hub. We don't use a cellular hub for Hypertension Plus. We use an app that's on your smartphone. So it has been designed for a specific market segment that we identified in the UK, and the physicians in the UK helped us identify it. Said, I have these patients who they're already cell phone enabled. They know how to do this. So I want a program that works via their cell phone. So it does similar things in that you take your blood pressure, it uploads to the cell phone sends it to the physician, but it also has an app in it that helps you see things. So you'll see your trend, you'll be able to get some education programs, you'll be able to get some coaching. So it's a different customer base, and it's a different target. And it's because of the way the physicians in the UK said, we would like the program to work this way. You still can get alerts with the physician can still call you, but it's implemented in a way that's different. And it's implemented in the way that the physician asked for it. It would be bad for us to say, here, doctor, use it this way, because that's wrong. It's the doctor has to tell us, this is the way my practice works. This is the way I work with my patients. So when we worked with the NHS and other people in the UK, they were able to give us the guidance required to do that. And we were able to tie in some other technologies into it that allowed it to be more than just hypertension. It can do other things as well, but its main implementation is to manage hypertension in a specific population of patients that they have designated as the ones that are at highest risk. Okay,
so so in comes the hypertension plus, not just hypertension, but there's other things, which is fantastic. And I think it really shows a great insight on OMRON's part, that it's not like this is what we have, this is what works, but instead it's what do you need, and we can definitely facilitate and lessen the burden of the day-to-day lives of these people that are already struggling. So that's kudos to you guys on that one. So
thank you. And it was important that we do that, because when we talked about the US, I didn't talk about it, but in the US, doctors being paid to take care of a patient remotely is a new thing. It wasn't, 5 years ago, that didn't exist. So we had to build it around this new thing. In the UK, it's been more of a, yes, I can take care of you remotely, mostly because doctors get paid differently in the UK than they get paid in the US. So even the financial back end of the system had to be set up differently so that the doctors could get the information, and if there was a charge, it could be managed through the insurance or through the government, whatever the process is. So what you think might be easy is very intricate, very detailed. It took a lot of actually experimentation to make sure it worked correctly.
Okay, fantastic. So now you have the HeartVoice for Singapore. So I'm interested in that as well.
So HeartVoice was different from the other two. So it's still our product, but we did a joint venture with another company who wanted to create a much broader remote patient monitoring program. So they wanted to be able to do temperature, diabetes. They want to do everything.
Oh, wow.
They wanted it to be the Cadillac. So we partnered with them to be the hypertension component of their program. And we work with them and we do programming, all that work. But because they wanted a different system to match up with the insurers that they have in Singapore, we built it in a way that works for them. It's still, it can do the same thing. You can be the same hypertensive patient, move them around, and they'll still get the same benefit. But this one is a broader program. It is app-based as well, but it has a lot more information on the app, which in the US might be too much information for the patient. But it is designed that way specifically for their market and for their needs.
Okay, and speaking of the app-based products from OMRON, I understand OMRON Connect has seen some recent advancements. Could you please tell me about that?
Absolutely. So we've had apps to bring in the information from our devices for many years. And the good news is we've learned over the years what's important. We've gotten good feedback from the consumer and even from physicians on the information. So we've updated our app a lot recently, within the last 4 months, 5 months now. We updated OMRON Connect. So first of all, we had what I would say a group of apps. Certain apps worked with one of our products, or a couple of our products, some worked with a different product. We eliminated that and brought it all into one app. So it doesn't matter what OMRON blood pressure monitor you have. If it's a connected monitor, you can use our OMRON Connect app. You don't have to have different apps for different products, which is great because if you upgrade or downgrade your unit, you wouldn't want to change apps. You'd want to be in the same app. So we've accomplished that. We also built it in a way that can be used in multiple markets, so that if they want to use the OMRON Connect app in Europe, there is a version of it that pops up, knowing where you are geographically, that works for you in Europe in the language that you're looking to use it in. So we've done that advancement as well. And we've also added more coaching, more insights to the app. I will emphasize, we're not trying to diagnose you or treat you. We're trying to give you information that will be helpful for you. For example, you might get an insight from the app in the morning that says, hey, I noticed you've taken your blood pressure 3 days in a row and it has been higher than normal. And it might suggest that you might want to call your doctor because this is unusual. Or it might come up and say, hey, welcome back. Notice you haven't taken your blood pressure in 2 weeks. Trying to encourage you to be more consistent. So these are things we could do and we added to the app and we learn from that. And as we learn, we update it even more. So we're constantly updating the app, but the new version of the app has a lot of that in it. We've also changed the UI UX to make it more friendly to the user. And we were rewarded well by reviews. If you go to the Apple iOS store, we've gone to a 4.6 rating from much lower in the past. On the Android store, we're growing. It's a little different. In the Android store, they use the global information and the long history of the app, so it takes longer to get it up, but we're headed in the right direction there. So we've learned from the past, we've made these updates, and we've made the app work better for the consumer and made it easier for them to do things like connect their product, choose the product that they want. Even now, when you go to use it, it says, you want to connect your OMRON blood pressure monitor. It comes up with a menu by picture, which monitor you have, so that you can select the monitor that's sitting in front of you and not make a mistake of having the wrong monitor connected to it. You have the right monitor connected to it.
Right, well, that's extremely helpful. And as you were explaining, hey, you haven't done this, and you should probably take it's almost like you have, once you get OMRON Connect, it's like you have a personal, I don't want to say like a nurse almost, like take your medicine type thing, like,
I'd call it, maybe it's your mom telling you, you need to do this. It's an advisor. We're trying to advise people. We're not trying to bully them. We're not trying to push them. We're just giving them the information, presenting it to them, and letting them decide what's right for them.
Right.
And if it becomes your habit that you only take it every 2 weeks, the app understands that and won't send you that message, say, hey, well, you haven't seen you for 2 weeks. It'll say, welcome back. It's time to take your blood pressure. So we are very cognizant of the way people use the app, and try to push out the information in a way that's not, we don't want to be someone's really pushing you all the time, poking you all the time. We want to be the person saying, hey, we saw this, you should know about this. We can even compare people to the population. So we can say, hey, we see that your blood pressure is lower than most people your age. And it's not a reward as in sense of getting something, but it is a reward in that, hey, I'm doing the right thing.
Right. Yeah.
And speaking of rewards, we have added rewards to the platform too, so that you can, if you sign up for a subscription, which gives you more information, you can also get rewards, so that if you take your blood pressure appropriately, and the number of times that you say you would, you'll get rewarded points, which can be turned into an Amazon gift card or something, and make you feel good about yourself and get a little bit of something along the way.
Absolutely. I'm 100% a believer in incentive-based, anything incentive-based. It's like, why not? It doesn't hurt. It helps you, it benefits you in ways that, are immeasurable. So, incentives are fantastic. You were talking about, gathering data and all these things. I understand that you are currently maybe exploring the potential of how AI can actually help you with your products.
Yes, we recently entered into a partnership with Kyoto University, and we are a Japanese company. So Kyoto is in our backyard, right by our headquarters. We entered agreement with the university and the university's medical centers to start looking at all the data around a hypertensive patient, not just your blood pressure, but your weight, your activity, whether you smoke, whether you eat the wrong things. Look at all that and see if there was a way to take that information, run it through an AI platform, and come back with insights that are much more deep than what we provide today. So to be able to, the goal would be at some point to be able to predict that you as a patient, be based upon all this information we have, are at higher risk for a heart attack or at higher risk for a stroke. Not to scare them, but to inform them. And we're doing this through the university. So it's not my team in Japan in a lab designing this. It is the university sorting through the information, putting the right AI mechanisms on it, and coming back with these nuggets, we like to call them, that say, hey, here's something we can actually predict or actually see. We started this a few months ago. They're working on it right now. We hope that in the next few months, we'll start to be able to announce information, announce studies that they'll publish. It will be all medically based. It won't be just the science of AI. It'll be medically based information that the user can use, or even the physician could use. So imagine if we can see that you as a patient are 50% more prone to having a heart attack. If the doctor gets that insight, he or she may say, well, let's look at this patient more deeply. Maybe I need to look at their cholesterol more. Maybe I need to look at their glucose. Maybe I need to help them lose weight. So it helps the physician frame what they're going to do with you. So it's an exploration, as you mentioned, and that's what we call it, an exploration. We may find out there's nothing there, but I believe we'll find out that there is something, and we'll start to be able to announce some of these insights and abilities over the next few months.
That's extremely exciting. I can't help but think that, like you said, you just started, obviously, but the potential of this is, and likely, I would say, if I was a betting man, then my money would be on beneficial. Absolutely. So I can imagine,
Yes.
you get a couple months, let's say 6 months for easy math, 6 months of data from a certain patient, or do you call them patients? I'm sorry, are they
Um,
users?
Depends upon who we're talking to. They're consumers. They're
Right,
people.
right.
We sometimes call them patients because of the way the healthcare is delivered to them.
Mhm.
But they should be consumers, and eventually, whatever we find out in the AI, for example, we can put that into the OMRON Connect app, which is a patient-facing portal. So we can take the learnings from the medical side and turn them into something that the patient can react to as well. For example, if you learn that it's your weight that's causing your hypertension, and we can show you that definitively, maybe you'll take the action. Maybe we can send you diet information and help you to get back into a better position.
Right, that's exactly what I was going to say. I can imagine, this technology evolving to where, it would be something like, a suggestion would be maybe change your diet, or maybe add this to your diet, or if you do such and such, yes, no, whatever, maybe, or whatever. And then you could actually, not diagnosis, there's a word for it.
They would get content that was specifically for, like today, Amazon or somebody tells you bought this, you might want to buy this. You'd get content that says, based upon your blood pressure readings or your blood pressure and your weight, here's some key food items you should be eating. There's ways to deliver that content to the patient right on the platform, and then it's up to them. The consumer can say, I want to do it, I don't want to do it, but it's always great to present it to them and give them the options.
Absolutely, yeah, options are the key. Absolutely. So this, like you're a global leader in this remote monitoring, and you have kind of branched out with the HeartVoice in Singapore, and now you're working with the AI. Do you feel that these personal monitoring systems, the ones that you can, sitting on your couch, you can actually see what's happening, do you feel that this was maybe a missing link in battling these conditions?
I'm not sure if it was missing. I think what the part of it that was missing was the physician-patient connection. So my dad took his blood pressure with an OMRON monitor, which was actually labeled Sears at the time, for many, many years.
Okay.
Before I was with OMRON.
Right.
But he never connected with his doctor on it. He never shared the readings, never did anything. I take my reading, and it can, when I go see my doctor, he probably dreads me coming in, because I come in with my already printed out, here's my blood pressure readings for the last 3 months. So there's no need for him. Yes, they take my blood pressure when I'm there, but there's no need for him to do anything other than look at those readings and say, hey, you're right, Randy, you're in control. So the connection was never there as well. And I think with connected products, especially, we talked about Vitalsight, HeartVoice, and Hypertension Plus, we're now putting that information proactively in the hands of the physician and letting them make a decision on what they want to do with the patient. If they want to change their medication, if they want to titrate their medication differently. We didn't even talk about titration, and that's a benefit of all three of these systems, is that if a patient's not responding to the medication, in the past, it was like 3 months before you made a change because you wouldn't see them again.
Right.
Now you're seeing it within days of putting them on a medication. You as a physician can say, hey, this is the wrong medication, I need to change it, or I need to up the dose, or maybe it's the opposite. The patient's so hypotensive, their blood pressure is so low, you want to take the medication down a little bit to bring them up. But those are things that took months to do in the past. Now they can be done in days. So it really, it makes it much more effective for you as a consumer, and much more effective as a physician, because you're getting that patient under control. And then they're not going to be showing up in the emergency room. They're not going to be calling you in the middle of the night because of their blood pressure being bad, because you would have already addressed the challenge before it became a challenge.
Okay, yeah, that's actually I missed that on my list, but yeah, I had it there. I had it.
I got it.
And I thank you very much. But yeah, Randy, I apologize, but we are, out of time for this one. But please, I'm very interested in what happens with the AI. So feel free in the future, anytime you want to come back. The red carpet is definitely out for yourself as well as OMRON.
I would be happy to come back and share on the AI, share on our progress of the apps. And I would just encourage anybody that finds this interesting, ask your doctor. Your doctor would be likely very excited to understand the technology and add you to a program that they may already have in place. So be proactive, ask them a couple questions and see if there's something that can benefit you.
Thank you very much, Randy.
All right, thank you.